Good to see you, Honorable Austin. The Delta State Health Commission seems to have pulled onto the road. Arising from your session today, how would you describe the direction of the Delta State Health Commission?
Well, I want to start by first appreciating the governor of the state, who is a medical doctor and a one-time senator, that also introduced this scheme at the national level. And when he became governor, he replicated that event here in the state. And why I said I want to appreciate him is because I'm a direct beneficiary of the scheme, and I know so many persons that have also benefited from the scheme. And it's a scheme that is working. The health insurance is something that ought to be mandatory for all Deltans. And so far so good. Delta State is taking the lead in the country, and we will definitely do the best. We will definitely encourage the commission so that at least 90%, if not 99% of Deltans have a full coverage of the insurance.
During the session, as followed from here, there were discussions around making or adjusting laws to ensure the effectiveness of this scheme. What are the lawmakers looking at in this direction?
Well, in the side of the lawmaking, certainly we are there to give all necessary support to make sure that the commission succeed. And certainly, I don't think that is an issue, just like what you heard me said there, that government is giving so much. If you classify budgetary allocations to ministry, like what I said there, after works, which is infrastructure, education is second, then health is third. And just like what I said there, health is life. It's not just wealth, it's beyond wealth, it's life. And a state that is so healthy is a vibrant and functional state. And thank God today we have a governor that is a medical doctor that knows it and is giving all the support and challenges towards seeing this exercise come to success. And today I know from the government pact, the laws are there, funds are distributed and released in due course, and I don't think that is much problem like what I said there. So if there are need to improve on these laws, the House is there and we are prepared. The legislative sector of governance has created that synergy towards working perfectly with the executive to make sure that Deltans benefit the dividends of government. So certainly we are going to do that. If there is need for us to either create an additional law or repeal an existing law to bring in a new law that will move with the trend, because the law is dynamic, it's not static. We will definitely do that, certainly, to encourage the commission. But it's the right path and it's the right thing to do. And I want to encourage their towns, because there must be an awareness, sensitization, the importance of the health insurance. What you benefit from the health insurance is 10 times far more than what you sow into the scheme. For example, if you are paying 7,000 as coverage for a year, take for example, you have a family of 4 and you are made to pay 20,000 as coverage for a year. And There is no year from the beginning of the year to the end of the year that malaria is the prevalence ailment that we have around us, that 1 or 2 persons from your family will not suffer from malaria. And by the time you are not part of the scheme, and if you go to any of these clinics or hospital, you will spend more than 7,000 to treat that child or that adult for malaria. But if you pay it, you have full coverage. You have medications for malaria. If you have high blood pressure, there are medications. And so it's something that Deltans must encourage to work. And if I'm only using this medium to create that sensitization to that, it is something that is mandatory, something Deltans must hold so dearly, so that if we have an healthy state, certainly we are going to have a very wealthy and a very vibrant and prosperous state.
The conflict between demand and supply of health services is not something we can wish away if a scheme like this must succeed. In your discussion today, the term strategic purchasing took the center stage. To ensure efficiency and success of a scheme like this, public-private partnership was mooted. What are your thoughts on this?
Yes, well, it's a new process, and certainly we are striving towards perfection. Today we are 20%. I'm optimistic that before we get to the next 2 years, we'll go above 20%, if not more, or close to 50% of it. But you see, what I want to say is like what we were all, most people were suggesting. You see, the public sector, like the name connotes, the public sector, if you involve them in managing businesses or facilities, it is quite different from when private individuals run business. Because you see, in operating an institution or in doing anything in life is guided by principles. There are different principles that guides the public sector, and there are different principles that guide the private sectors. And I know, because I've also experienced it, I've seen both sides of the aisle, and I know that in the functional societies, like in the Western world, name it Europe, the Americans, or some developed parts of Asia, the hospitals, the secondary health facilities, or the tertiary health facilities, or the primary health facilities are managed not by government. They are managed by private, independent institutions. It could be a volunteer body, it could be Caritas, it could be this, but they are managed by private individuals, and that is why you see results. If you pay for health services, you see the services. So I know certainly not that the public sector, government has created the structures. And as we progress, if we find out that government cannot manage the structures properly to the satisfaction of we, the people, we can bring in private hands to help government manage those facilities. That is why you see PPP. And that is, I think, from the summit here, that is one of the major things that is lacking in this contributory health commission or services. Government is doing their part. If you look at the percentage rating, the private sectors have not come in fully. But the process is being driven by government because it's new, and which is okay. I've not said there's anything bad there. But we need to engage the private sectors in our public hospitals, our primary health centers, and our tertiary institutions like the teaching hospitals and everything, so that we can bring private hands to come and protect what government has established.
Before I let you go, sir, you are an opinion leader and the representative of the people. Like you said, you are a beneficiary of this health scheme. Will you chest out and encourage Deltans to buy into this health scheme?
Yes, my word advice is I want to encourage all Deltans to find where they can enroll for this insurance scheme. Is economical, safer, and better, because you pay 7,000 to get an insurance coverage for a year. It is something everybody must be part to. I am enjoying it because as a civil servant, I have that deduction at source. But today, I can go to any of these private clinics. I have specific clinics that I attend with physicians that are consultants and the rest. And I just go there, bring my card, they treat me for pains, malaria or otherwise. And I'll just walk out. So it's working. I want to encourage Deltans, both the vulnerables, the strong, to please be part of this scheme, so that at least we will see this scheme not dying away, but the scheme would have come to stay, so that that percentage, that optimal percentage of what is obtainable in the civilized society is here for us, so that once you have your insurance coverage, you are okay. That's it.